Good morning, everyone. My name is Kathleen McGann, and this is my presentation for CSD 440 on Wernicke's aphasia. According to the Dictionary of Medical Terms, Wernicke's aphasia is defined as the profound inability to comprehend speech or written word, usually as the result of a stroke to a specific area of the brain. Wernicke's area. The ability to speak is fluent, but frequently does not make sense. It's also known as fluent aphasia or receptive aphasia. For all purposes of our course, Dr. Sather said he would use fluent aphasia and Wernicke's aphasia interchangeably. So for the anatomy of Wernicke's area, it's located in the superior temporal gyrus in the dominant hemisphere, which for most people is the left hemisphere, as they're right-handed, and it corresponds with Brodmann's area 22, which functional area is higher order auditory cortex. So Wernicke's area is responsible for language comprehension. It's how we comprehend and understand language. The possible causes of Wernicke's aphasia, the most common cause is infarct in the left MCA inferior division territory, a lesion of Wernicke's area and adjacent structures in the dominant temporal parietal lobes. According to the National Aphasia Association, the most common cause of aphasia is stroke. 24 to 40% of stroke survivors acquire aphasia. Wernicke's aphasia represents 13% of all patients with aphasia. Can have sudden onset from brain injury, or it can occur slowly as a result of a neurological disease or brain tumor. The symptoms of Wernicke's aphasia are impaired comprehension. Patients often speak fluently, but it doesn't make any sense. There's errors at both the phonemic level or the word level. They may string together a sequence of meaningless words to sound like a sentence with normal rate and prosody, so they are having conversational fluency, but what they're saying is not making any sense. Repetition and naming can both be impaired. Reading and writing shows similar impairments to the speech deficits. Usually no signs of physical damage. The patient is usually independent in self-care. So there's some competencies that can be revealed with Wernicke's aphasia. So one speech pathologist in an article I was reading was saying that, so these patients don't understand demands at all, like, go get my coat. But if you were to say, why don't you go get your coat, it's pretty cold outside, that is something that they could potentially comprehend. Wernicke's aphasia, you could be mild, moderate, or severe. It just depends. There's different co-occurring symptoms with Wernicke's aphasia, such as lesions in the temporal lobe can cause contralateral visual field cut, especially of the right upper quadrant due to involvement of the optic radiation referred to as pie in the sky defect. Apraxia can also be present, but it's hard to determine due to poor comprehension skills. Patients with Wernicke's aphasia often fail to recognize their own deficit, so one speech pathologist even said with Broca's aphasia, it's usually the patient is getting really frustrated because the therapist isn't understanding them. But in this situation, sometimes the therapist can get frustrated because they're not understanding the person at all, and they don't realize that it's hard to understand them. Paranoia or angry behavior can also occur, and that behavior can be misunderstood for a psychological disorder, schizophrenia or something to that degree. Dysarthria and right hemisperiasis are typically absent or very mild. That's actually more common in Broca's aphasia. So in the assessment for Wernicke's aphasia, you would meet with the family, gather background information, medical history, then obtain a functional measure, inpatient functional communication interview. For the interview, you want to be a detective. What does he or she use? Because you want to be able to understand fully what the person was doing, before they suffered this injury. And then standardized tests provide little information, so you want to personalize things, get to the background information on the patient and use it to engage the patient in the interview. If you can build on the patient's interest, it can increase success in the therapy. And then you want to interact with the patient. The patient must understand that the speech pathologist is there to help him or her, and the speech language pathologist must understand what's important to the patient, what's what is their needs, what are their wants to come and benefit from therapy. So speech pathology or speech language therapy can be difficult to implement with people with Wernicke's aphasia because there's significantly less attention for Wernicke's aphasia in the medical and speech pathology literature. And these people have very little comprehension. So success is hard to achieve because stimulation and repetition are typically, they're not there, and these patients can't respond to demands. There's little awareness, and as a result, the inability to respond to feedback or instructions. So even if you're saying good job or try again, they might not understand that, and it can make the therapy session very difficult. But there are suggestions for speech language pathologists in choosing a treatment method. Interrupt the cycle of unsuccessful communication as soon as possible. Find the model in which the patient can receive some meaningful input and make sense out of his or her world. And then identify predictable contextual routines which the individual can begin to express and comprehend successfully. So there are different treatment approaches. Augmented input, any visual verbal strategy employed by the communication partner that increases the message comprehension of the communicator with aphasia. Partner-supported strategies includes partner and environmental context. The goal is better communication and increased participation in relevant life activities. And a context-based approach, the goal is to improve listening comprehension and information exchange in authentic communicative texts. There are some risk factors with Wernicke's aphasia. Although aphasia is more common in older people, it can affect people of all ages, nationalities, and genders. Aphasia affects more than 2 million Americans and is more common than Parkinson's disease, cerebral palsy, and muscular dystrophy. Nearly 180,000 Americans acquire the disorder each year, and most people have never heard of aphasia. So there's suggestions for family and friends from the Aphasia Center to effectively communicate with someone with Wernicke's aphasia. Use gestures when you speak. Write down key words while speaking. Talk about things that are relevant to the right now. Don't shout if the person isn't hard of hearing. Speak slowly and be close enough to maintain eye contact. So I attached here a video. It's a good short clip to understand what fluent aphasia sounds and looks like. You will recognize the symptoms that I mentioned in this presentation. Thank you.